Nurses rallying on Capitol Hill against proposed cuts to Medicaid.
These nurses from Flint say those cuts could also result in the loss of health care for millions of people.
Two of them tell TV5's Zain Omer those cuts would mean cutting people off from life-saving health care. Zain?
Genesee County is one of the largest counties for Medicaid in the state of Michigan, and the two nurses I spoke with tell me the cuts would be disastrous and devastating.
Flint took a hit with the Flint water crisis. We've taken a hit with COVID, and we're finally starting to get back some ground, but it's time that our political representation steps up and does what they promised us to do and start funding the hospitals, the healthcare workers, and their residents.
7 nurses from Flint walking the halls of the United States Capitol in a push to stop potential cuts to Medicaid.
It's really important for us to share our stories with our lawmakers so that they understand what this means for us, seeing the consequences face to face.
The big beautiful bill, now moving through the Senate, looks to slash federal spending, proposing changes to programs like Medicaid and SNAP.
We're taking money away from a program that is needed in order to keep people alive and to keep people safe.
Rachel Chapin, a nurse at McLaren Flint, says if it weren't for Medicaid, she wouldn't have been able to go through nursing school.
I was a single mom and my daughter was on Medicaid, and it helped me to be able to have health care during that time. And now that I'm a nurse, I take care of a lot of patients that are on Medicaid. You know, in Genesee County, there's a lot of folks that depend on Medicaid for their health care.
For hospice nurse Julie Campbell-Inman, the majority of her patients rely on Medicaid and Medicare.
We go into their homes and we train them. We get them the supplies that they need. We get them the equipment they need, but we give them the education, the training, and the support that they need so they can take care of their loved ones and keep them home for their final days. And without that, they're going to end up in the ER and not the care and love from their family.
Both nurses are also concerned about the impact Medicaid cuts could have on the healthcare system as a whole.
What ends up happening is people use the emergency room for their primary care physician, either when they need something, they need medication, or their chronic condition gets to the point where it is an emergency. And then you have these super long wait times in the ER. You have really sick patients taking up hospital beds that didn't need to be there.
As they speak with passersby in the Capitol and meet with representatives, they're hoping their plea will be heard.
We have seen it through our history in Flint. We have united many, many times. It is time to unite again to prevent these Medicaid, Medicare cuts.
The group of nurses are hoping to talk with Senator Gary Peters and Senator Alyssa Slotkin. Slotkin has previously voiced her disapproval of the cuts, while Peters' office sending us a statement saying in part, if Senate Republicans move forward with this bill, it would threaten the health and security of children, seniors, and people with disabilities. I would never vote for a bill that does that, and I'll keep fighting to protect Medicaid coverage for families in Michigan.